This video will present steps to mentor a student who is performing a metal frame adjustment. Keys to performance include the availability of the proper tools and an understanding of how to use them. The student must also follow the proper sequence of adjustments to achieve an accurate and comfortable fit.
Okay, that looks really nice.
The 5 key elements of the mentoring process are modeling, coaching or scaffolding, reflection, articulation, and exploration. In this case, the first step would be to model or demonstrate the proper adjustment of a metal frame on a patient.
And vertical alignment.
When helping the mentee to adjust the metal frame, they can demonstrate or talk aloud while performing the adjustment so the mentee understands each step. This can be done with a coworker or a customer who gives permission. As the mentor demonstrates the adjustment, they should also explain why they are using the tools selected and stress the importance of following the proper sequence.
Okay, Gabby, this is Lindsay, and Lindsay has agreed to let me show you how to adjust the glasses and how to look at the glasses and what things to check for you, okay? So, one thing with the adjustments, you always want to make sure before we do any measurements or anything like that, that we look at the glasses, make sure they're fitting properly and that all the adjustments are done even before we're going to do any measurements on the glasses, okay?
Okay.
I'm going to put these on Lindsay. I always like to put them on myself and use 2 hands, and then I assure that they're sitting down and level on her ears. And then as you look at Lindsay, you want to assure that that frame is sitting level on her.
Okay.
And I also sometimes will just look down from the top, and you can check that vertex distance, that it's the same from each eye.
Okay.
If it's not, it could be one temple is pushing in too far or out too far, and then we would need to adjust that.
Okay.
In this case, that looks good, do you think?
Yes.
Yep.
I will. Yeah.
Yep, I think that looks good. Okay, good. Very pretty on her, right? So she smiles, it's not sitting on her cheeks. If she turns sideways, you can check that vertex in the panoscopic tilt as well. Make sure she has the right amount of angle there.
Okay.
Again, it's another adjustment that we want to do right up front.
Okay.
Again, I want to make sure that this right here, where that is just a very fine touch. Okay. So we're going to take that, and you can use your double padded pliers and put it in there, and you can adjust these in or out to make sure that that's not touching too much on one side, pushing in or out. That will affect that vertex distance as well there too.
Okay.
See? Okay. One of the most important adjustments with your metal frames is to ensure that those pads are fitting her properly. And many different people, whether they're different backgrounds, their noses are going to be very different. So sometimes you have to splay these nose pads back all the way, and maybe an Asian type nose that doesn't have as much, or if somebody has a bigger, broader nose, then you have to adjust that. I really like using this pliers right here to adjust that, and you can just change that curve one way or the other. You
Okay.
see?
Yeah.
Okay. And then I want to assure when I put that on Lindsay that I have really good touch. Now I need to change that adjustment pad a little bit. You see how it's angled in right there and pressing a little bit more
Yeah,
down?
I can see
Okay.
that. Mhm.
Let's take that off. Put that there. Just back. I need a little bit too.
Okay.
Changing these pad arms too can lower or raise that frame, so depending on, again, those adjustments for progressive lenses or any other type of lenses, we want to make sure that we have that flexibility to be able to make that perfect for her. Good. Now, you see looking at the nose how you have even touch all the way around.
Yeah.
There's blade to fit her perfectly in the vertical alignment. You're sitting straight across the top.
Okay.
Okay.
Yeah, that looks good.
She again looks sideways. You're checking the panoscopic tilt. We already checked the vertex, but I like to kind of finish checking it too, because if we made any adjustments all the way along, you have to remember one adjustment's going to affect something else. So if I angle this temple out, that's going to affect that vertex distance as well too.
Okay.
So once I finish with everything, I'm going to put them back on. I'm going to look down again, make sure that my vertex is still perfect.
Yeah.
Sit down. Now, one of the last things we're going to do too is we're going to check this temple bend, because that actually starts to bend right at the top of the ear, and it's going to come down back behind her ear. Okay?
I see that. Yeah.
And not everybody's ears are in the same position, so we want to make sure we do it for each one individually. So we don't just take them and bend them exactly the same, because she might have one ear that's up a little closer, back a little further, and then that could cause her some discomfort.
I see.
Okay, so we're going to check each one. You can heat this and bend it with your fingers. Sometimes people like to use pliers that actually can bend that frame itself too when it's warm.
I see.
Some of them are just really hard and stiff to bend. I prefer to use my fingers, but there's just different ways to do it. Okay, so we're going to bend that down. Let's check that one side. Good, okay, turn sideways, Lindsay. Then you're looking, you actually want that bend to come down right along the ear there.
I see that,
Okay?
yes.
Let's see this side over here. Let's see how much we have to do there. See how that one we need to bend a little bit more?
Yeah, I can see that, yeah.
Okay. And take that. Again, I like to use my fingers and my thumb there, but you can use the tool, so that's just a matter of preference as to adjusting and bending that down. Okay, you would bend that and bring that right down along, and that curve then follows the back curve along her ear. So turn sideways, Lindsay, and as we're checking that, we want to make sure that that bend, it comes down here, but also it follows the contour of the head there, because sometimes people are going to have a little dip right there from the mastoid bone and how that goes, and you don't want it pressing in there.
Okay.
Sometimes you can use your finger like that, or that's when it's really nice to be able to use this tool, and you can actually dip right down there and bend that so that it provides that same little contour and dip that she has behind her ear.
Oh, I see, okay.
Okay? Put that back on. I like to keep my fingers right back behind there so I can feel how snug or how tight it is to make sure that it's not going to hurt her or it's not going to slip down her nose, okay? We know she's into sports, she's always outside playing, so those are things we know, and fitting her and talking to her, we want to make sure we address that during the adjustment.
Okay.
Okay, so turn sideways. Good. Now you see how that came down and then that fit right into the contour.
Yep, I see that.
Good.
Coaching, or scaffolding, involves providing the mentee with verbal support of cognitive activities needed to perform the competency.
And then I'm going to come back and
For this competency, the mentor would now allow the mentee to perform the adjustment while checking each step. If necessary, the mentor will correct the adjustment while providing a verbal description of the correction. Reflection is where the mentor encourages the mentee to review their performance on a competency.
doing the adjustments.
The mentee should think about what worked and what did not. They should also consider what they need to do next to improve their performance. For example, the mentee is asked to reflect on the adjustment they just performed.
That looks really nice, Gabby, but I want you to kind of check everything with Lindsay, and you tell me, what do you feel about this adjustment? How do you feel?
Okay.
Following
It
reflection,
was really good.
the mentor needs to encourage the mentee to communicate their findings. As the mentee articulates their perception of their performance on a competency, the mentor can agree or provide additional suggestions. For example, in this case, the mentee should talk about why the adjustment was difficult for them to perform. Was it their lack of experience in selecting and using the proper tools? Was it because they did not follow the proper sequence in performing the adjustment steps? Was it due to the patient's unusual features? The mentor will help the mentee identify areas they need to work on.
So, Gabby, what did you think was the most difficult part of doing the adjustments for Lindsay?
I think I need more practice with the tools, and also I need to review the sequence of the steps I need to take in order to adjust the para class as well.
Good.
Exploration involves giving the mentee room to solve the problem on their own. The mentor slowly withdraws some of their support, coaching and scaffolding, and allows the mentee to perform the competency on their own. In this case, the mentee should be supervised closely prior to independently performing the adjustment. They will eventually begin to solve their own problems. Thank you to Hillsborough Community College, the Opticianry Summit, and the American Board of Opticianry for their support of this project.